Welcome to today's broadcast of North Idaho College Public Forum. The crew is comprised of NIC television students, and your moderator is North Idaho College political scientist Tony Stewart.
Today we wish to discuss one of the most important and serious topics that is being covered around the United States today. You've heard so much about this subject, but we too feel a responsibility to discuss the issue of AIDS. And in doing that, we're going to talk about the medical facts of the disease and also something about sexual practices and what acts and practices are safer than others. In order to discuss this very serious topic, I'm very happy to welcome to the program two individuals who recently spoke at North Idaho College lecture series and are with us now to do this television program. First of all, I would like to introduce Joe Marinovich, who is the nurse and heads that program at North Idaho College and serves all of our students. And we also have Joanna Fouché, who is the health director of the Panel Health District, which covers the northern part of Idaho. You both were so good at what you did earlier with our students that we wanted to have this program, and I'm happy to welcome you today.
Thank you. Tony, I do need to say I'm educator instead of director.
That is correct. It is the educator at the Panel Health District. Larry Belmont will correct me, I'm sure. Joe, let's start with you first in dealing with this important topic. We've heard much in the literature and also on television interview shows such as this one that AIDS is, first of all, a new disease as far as we know and affecting individuals. And I have a two-part question. First of all, when did we recognize this problem medically in this country? And then would you take us through the three stages of the disease and identify those for us, please?
Okay, Tony. It was identified in 1981, but they feel, going back in records, that it was with us at least in the late 70s. But 81 was when it was really diagnosed as such. AIDS is caused by a fragile little virus that needs to be actually in a body cell to keep it alive. And so it likes thick, nutritious body fluids such as blood or seminal fluid or vaginal secretions to keep it alive. Actually, the way it works is in the defense mechanism of the human, the white cells do different things, and one of the white cells is called the lymphocyte. Okay. The lymphocytes have B cells and T cells, and the B cells are the ones that actually go out and grab the organism, the disease-causing organism, and kill it. The T cells, there are two types: the helper cell, which kind of motivates the B cell to get in there and do its thing, and then the suppressor cell, which after everything's over and done says, "Cool it, guys, you did a good job and everything's back to normal, and so we're okay." So the AIDS virus gets into this helper cell and renders him more or less useless. And so the suppressor cell multiplies and says, "Everything's cool, don't worry," and when in actuality it's not all right at all. So in a normal human being, healthy human being, the helper cells outnumber the suppressor cells 2 to 1. But in the AIDS victim, the suppressor cells far outnumber the helper cells. So there are three types of patients that you are dealing with. The first is the one that has come into contact with the HTLV virus, that's the AIDS virus, and that person does not have any symptoms, is perfectly healthy, exhibits no symptoms at all, and he or she is positive for the antibodies 2 weeks to 12 weeks after exposure to AIDS. Okay, now it can be passed on even though they are healthy individuals. So, but not all of these patients get AIDS. Not all of these people get AIDS. Some of them, about 5 to 10% are diagnosed as AIDS each year, and some of them develop ARC, which is the next step up.
Before we go to the next step, though,
yes,
from the literature that I have read, and we've had the opportunity to listen at the forum, there are some individuals, though, that will register positive, but at least up until this time, the statistics indicate that they will never move into stage 2, that they will never acquire the AIDS as far as being detrimental to them in their life.
That's probably right. Now, we've only known about the positive antibodies for 2 years, so we'll have to see down the future how many of these people actually do, become infected with the AIDS disease. So, all right, the next is the ARC, the ARC, and that's AIDS-related complex. Okay, now this must be diagnosed by a doctor, and you have kind of vague symptoms, which other people can have too. Anybody with a good virus probably has some of these symptoms, but they include loss of appetite, weight loss, fever, night sweats. They may have skin rashes, diarrhea, enlarged lymph nodes, and they may not have too much resistance to infection. Okay, now, so far, 5 to 20% of the people with ARC go on into AIDS.
So, again, we want to try to keep all the facts as clear as we can. On the first stage, there are people who register positive and they don't go any further. And then of those who go to stage 2, at this time anyway, a small percentage of those actually are moving on to stage 3, which is the deadly stage. Yes,
and some of them improve, their symptoms improve, and some of them, the symptoms are kind of just suppressed, and they just go along, at the same time. And again, we're not sure in a lifetime how many of these will convert to the AIDS.
But statistically, in those first 2 stages, the news is much better than, of course, in the 3rd stage it's not.
Yes. So 5 to 20% of these will convert. Okay, now, the last and the deadliest is the AIDS disease, and that stands for Acquired Immune Deficiency Syndrome. And with this, you have persistent cough and fevers and shortness of breath, and again, this must be diagnosed by a doctor. And then the immune system really breaks down, and you're just susceptible to any bug that wants to come into the system, even those that are fairly nice bugs, that don't cause any illness in human beings, will just overwhelm completely an AIDS patient. So, and the things that they get a pneumonia, a pneumocystis pneumonia, or they might get a cancer, which is called Kaposi's sarcoma, and it's very rarely found outside of AIDS patients. The only other people that have it are very, very old men in their 80s that are really run down and their immune systems have broken down. So another thing that it would hit the brain and the spinal cord, so you have lots of neurological symptoms. About half the AIDS patients have neurological symptoms, and you might die of a brain abscess. But once you get AIDS, it is always fatal, within 2 years. Probably.
Right. Before we move on to our other guest, I want to take this one step further, because you've been so clear in explaining those 3 stages. Not only is the disease new, historically speaking, but we also heard early in the information that came out 2 or 3 years or 4 years ago that it was confined to particular groups. I would like for you to give us a little information and that's changed, and that certainly for any individual or group who might just look at the disease being confined to one area, they are in error themselves. And would you elaborate upon that, please?
Okay. At first, it's been about 70% homosexuals that have AIDS. The next highest group are IV drug users with street drugs and sharing needles. And then before the antibody test came out, those who got blood, hemophiliacs, anybody that got blood, had a higher risk of getting AIDS, because at that time we didn't screen blood like we do now. So those were the people that mainly got AIDS. Now it's crossing over into the heterosexual population, and so we feel that in the future the percentages will come down on the homosexuals and will go up, so it'll be just about even.
About even between homosexuals and heterosexuals.
Yes.
Okay, so this is kind of a historical question, and then I will move on. But this is not the only disease that's appeared all at once in the human race. There are many, many others that have done so. But this is not unusual, is it, that when a disease first appears that it may be more isolated and then it becomes a more general population problem?
That's true. And they think this started in Africa. They don't know really for sure, but it didn't take it long, and now I think the United States has more cases than any other country in the world. So it is really a public health problem, and it is going to be for all of us.
I wish I had time to get into the political aspects to talk about funding and all, well, maybe another show later, but because it has become a problem in relation to the general population, I think government is beginning to finally decide that maybe they should fund research and deal with the problem in a different way than some of the apathy that has been there before.
Yeah.
Joanna Fouché, let's come over to you now, and certainly as a person who is an educator in health problems at the Panhandle Health District, you have gotten some excellent information. I've been impressed with it concerning, let's deal with some of the known facts and contrast that with some of the misinformation that gets going in all these kind of issues. Would you just take a little time to separate misinformation from proper facts?
All right. Thank you, Tony. One of the things that what we are trying to do as far as getting education out to the community is that there is a lot of fear involved with the AIDS, because once you do get exposure to it, or you do get the virus, there's a good chance that it may develop, and eventually there is a good possibility that you may end up dying from that. And so, but there are so many good things about getting the education out too, because AIDS is very preventable. And that's one of the things that Panhandle Health is doing educational programs on, trying to get people aware of this. Why we are trying to educate people is there's a lot of our young, productive adults are being killed by this disease, and we'd like to have that come to a halt. There are a lot of the adolescents are experimenting with drugs and sex, and they need to know the dangers involved in this. Used to be that there were a lot of, or there was little sympathy for people who had the AIDS, because they thought, oh, okay, you got this disease, that's just, you deserve what you get. But now where it's going into the general public, through the bridging groups, the bisexual men, the prostitutes, the different drug users and that, and getting out into the general population, it's a disease that we need to treat, and we're not treating people, we're treating a disease and trying to control that. And it is important to try to prevent the spread of this, because we want to preserve our humanity and also the intimacy of our relationships. I'd like to give you some information. By 1991, they feel the Surgeon General's report indicated that there may be as many as 270,000 cases in the United States, and by that time 179,000 people will have died from AIDS, and that's just in the United States. And for our businessmen who are always concerned about costs, by 1991 there is an estimate of 145,000 patients will require health and supportive services, and this is going to cost anywhere from $8 to $16 billion. So there's a cost factor involved in this too. We're all going to end up paying for it. But AIDS is preventable, and it can be controlled by behavioral changes. Some of the information we got as far as the myths that might be involved, the virus is concentrated in the blood and in the semen. Those are the two body fluids that contain the highest amount of that. I
believe also Joe mentioned a third body fluid, so we get that clear too.
The vaginal secretions.
Right, it's there also. A lot of people say, oh, well then, as far as kissing and things like that, there is a smaller concentration of the virus in blood and in tears, but the concentration is so small that they don't feel like that is one way that it would be transmitted. the hugging, kissing, then those social contacts are not a way that the disease will spread. It has to be more through exchange of body fluid or through the use of unclean needles. Now, there's always another point I like to bring up because this is always interesting. I get a lot of comments on this, but if you have someone in your family who's having their ears pierced, or you're getting some tattoo work done, or acupuncture, it's very important to go to a professional to have that type of work done, because you want to make sure that the needles are sterilized and it's a very clean procedure, because if the needles are dirty, that's another way that it can be transmitted. But the disease is transmitted through the exchange of body fluids, through either semen or blood, or it can be transmitted from a mother. If a mother has AIDS, then she can transmit that to her child as well, either through birth, or the virus will also go through breast milk. But the mother would have to have the AIDS virus in her body in order for that to happen. But as far as transmitting the virus, through handshakes, hugging, kissing, that type of thing, or even people ask me this at a talk I gave the other day, can you get it from a toilet seat? And no, those are all casual contacts, and the virus itself is very, very fragile outside the body, cannot last for more than 2 to 4 hours.
Would you explain some of the ways that the virus dies just from when outside the body through even heat, hot water and so forth, or alcohol and...
Right, it's very fragile. It's destroyed by, like I said, heat. Common household detergents will kill it, your disinfectants. And in the hospital, the protocol to use for hospital cleansing of an AIDS patient is with a diluted household bleach solution. So it's very fragile and will not last outside the body.
Even, you also talked about something the other day was very important. In homes where there is an AIDS patient, some people ask the question, well, how about the rest of the family? And I don't believe we have any cases at all where other members of the family from casual contact have gotten AIDS simply by even caring for AIDS patients.
That's correct. If an AIDS patient is in the home, unless there is some sexual contact between another member of the family, there will not be any transmission, and they found that to be very true. The other thing with the children, taking a child and putting a child in school, there has been no cases reported where another child has received the AIDS virus from that particular student. The person who is at risk in that situation is the child, he or himself, or herself, because the immune system is so destroyed, and that child then is the one who will pick up a disease. Say chickenpox comes to school, or measles. That child has no defense system, no way to fight that virus or bacteria that might be there, and so that child may die from chickenpox or even any type of disease that might come to school.
Excuse me, go ahead.
Oh, I hadn't gone over any statistics. I didn't know if you...
Yes. Let me ask one thing, then we'll get back to those because of the limited time. We can only cover so much, and in a minute I'm going to have Joe to talk about some preventive methods, but I just want to be as much help as possible to the public, so those who would like more information, I know they can contact you and your office, and would you tell them about how to contact your office? And secondly, there is some very important literature that is now out that is available to the public too. Right.
We do get calls. I get quite a few calls recently, a lot more interest involved in the AIDS testing. We have an epidemiologist on staff. Her name is Jan Palmer. Everything is very confidential, and we want to be sure and stress that, because it must be confidential, because we need to follow up. We need to have people come in if there is a problem there, and they need to have a test. And what we will do then is follow up with those people, have them contact the people that they may have had contact with, so that we can follow through and prevent the spread of this. Also, if a person is needing a test, they can go through their private physician. We do have also a lot of information we were just able to receive from the American Red Cross, some real excellent brochures, and we do have those available now, so people might be interested in getting some facts on AIDS can stop in and request those.
Let's give a telephone number too for our viewers in case they would like to call you.
All right, it's 667-3481.
667-3481.
Right.
And if they're out of our city, of course, that's area code 208.
Right.
Very good. Joanna, let's take just about another minute or a minute and a half with a few statistics, choosing those that are most vital to what we are discussing to share with our viewers.
Well, currently we have in the United States approximately 30,000 cases of AIDS right now, and I'm going to say this is March 1987 because the statistics change so rapidly. We have had at the current time 16,500 deaths in the United States just from AIDS. In Idaho, we have 8 cases of AIDS that's officially reported, and there are a couple of cases that haven't made it onto the official record yet. But officially on the records there are 8 that have AIDS, and there are 6 people in the state of Idaho who have died. Now those are just Idaho residents. We have had 4 people in addition to that come into Idaho and have died in Idaho, so there's actually been 10 people in Idaho who have died from AIDS. I'd like to give you some information too about our blood supply because I feel that's very important. Our blood supply is very, very safe. I can give you some information from Snake River Blood Bank in South Idaho because they've had over 70,000 samples donated. Of those, they've had 411 tests that have come out positive. Now that indicates that what we're trying to show is that our blood supply is very safe. Any of those that have had a positive test then are discarded. None of those samples are used in our blood supply. But to confirm that, we send samples also, the Red Cross or the blood bank sends those samples down to the CDC in Atlanta. Then those are tested for the Western blot. We've had 5 that come back on that. Those people then are followed up for the AIDS virus.
That shows how much you're controlling the blood supply, and that's very good. I've got to go back to Joe because I don't want to end the program without dealing with another very important aspect of this. And as Joanna has also indicated, they are what we call safer sex practices. And Joe, I'd like for you to go through some of those for our viewers and talk about, as people are intimate, how they should protect themselves. If you do that for us.
Okay, Tony. Well, the safest practice is abstinence. And abstinence is an either or. You're either 100% abstinent or it doesn't count. So, but that is the safest practice. And of course, never take IV street drugs and use dirty needles, no matter what your sexual practices are. Okay, the next is, safest, is a totally monogamous relationship with somebody who is as selective in their sexual partners as you are in yours. And if there are no outside sexual partners on either side, and if you've been together for at least 5 years, this goes for homosexual couples or heterosexual couples, well then you're not considered high risk. Okay, there are some high risk people that you shouldn't have sex with prostitutes for 2 reasons. One is that frequently they are IV drug users, and the other reason is that they've had an awful lot of sexual contacts. And any time that you have sex with a person, you are also having sex with whoever that person has had sex with for the last 5 years, because you can get these organisms, from those sexual partners. So you have to think of that. Another high-risk group are bisexuals. And sometimes it's very difficult to know when someone is bisexual because it doesn't come up in ordinary conversation. So, so you have to know your partner pretty well. Another high-risk group are just the people that have sex with a lot of multiple partners. And the more people you have sex with, the higher your odds of getting AIDS are. So, you ask yourself when you go out looking for some action, is this really worth my life? And it will probably in the future come to this. So you have to be aware. Also, if you do have sex with any of these high-risk groups, you should wear condoms. And condoms should be used from the start to the finish of the sexual act. It does prevent the body fluids from merging, and they feel that this will help. They don't know how much it will help, but it will help. So use condoms if you're high risk, or else change your behavior.
Okay. In relation to that too, Both of you have been indicating today that, and I think in a very clear way, in a specific way, that one of the things that is very, very important, and you've identified those different kinds of fluids in the body. And if I understand it correctly, what you're saying, and other things that I have read about too, that it's very, very important, as much as possible, to avoid, correct me if I'm wrong, but even in any relationship, that the exchange of fluids just simply increases that, and so yes, to not have that exchange.
That's right.
That's true. The more bombardment there is to a body, the more apt that the unsuspecting or the person who doesn't have the virus is more apt to get it from a person who has, because there's more exposure, and after a time, the defense system will not be able to fight that off.
I would like to get a little bit, just in a little time we have left, into the political aspect, because politics seems to always come into play in any issue that affects the public. And as you've indicated earlier, there are some individuals who have pronounced certain things that have frightened people, or as I would say, we could even be honest to say that in some political campaigns, some people have used this for what they consider their political advantage. And my opinion would be that would be tragic to deal with anything this serious for a political advantage. Do you think that this information that you're getting out and others that are in the health field all over the United States will assist in those running for office and those in government dealing with policy on a more information-oriented basis rather than making some rather emotional suggestions? How would you react to that?
I think that Dr. Koop, the Surgeon General, should be commended. He has been wonderful. He has gone above political aspirations. He's gone above the special interest groups and just addressed the problem. It's a public health problem, and he has addressed it the way he should, and I'm really very proud of him. I think that he really, has been a very good person to do this way, and he's apparently very conservative himself, so it goes against his whole grain, but he sees it as a public health problem.
Maybe it's not a fair question knowing where you're coming from, but would you say this disease has been another very clear example of why sex education is important within the school systems and even at the family too?
That's very true, and now they're disagreeing about when you should start this, and Dr. Koop says third grade it should be, at least start things in third grade.
I'm going to have to interrupt. I wish we had another 30 minutes so we could pursue this. You've been so informative, and I appreciate the time of both of you, both today and your other work at North Idaho College. Thank you again.
Thank you, Tony.
Ladies and gentlemen, our guests today have been discussing a very important subject, and that is the question or issue of AIDS, and we hope this information has been helpful to you, and I would like to invite you to be with us again next week at this same time. Until then, please have a good week. I am Tony Stewart.
North Idaho College Public Forum can be seen at the same time each week over this station. This production was videotaped earlier by an NIC student crew for viewing at this more appropriate time.